What's going on, guys? The regeneration session today I want to take you through is going to be based on kind of helping out some knee pain. See if we can loosen up everything around the knee to kind of get you some relief, all right? So, as always with our regeneration sessions, let's start with about 20 minutes of light cardio. We want to get the body temperature up, get the blood flowing a little bit. If you don't have a full 20 minutes, get 8 to 10 minutes just to get moving a little bit so we can get the most out of this stretching session, all right? Now, to start, we are going to massage stick our quads. You can do this seated or standing, but we want to make sure we get inner quad towards the inner thigh and then the outside of the quad as well. And we want to get about 45 seconds or so a piece on each quad, all right? So again, you can do this seated or standing. Then we're going to massage stick our hamstrings. Again, seated or standing. You're going to get about 45 seconds or so on each. All right, so make sure you're working from the back of the knee, basically to the bottom of the butt. Okay? Then we're going to massage TFL, which is going to be kind of hip flexor area towards the outside of the hip. Want to work about 45 seconds or so there as well on both sides. Again, standing or seated, whichever one you prefer. Once we finish that up, don't do the foam roll yet. Once we finish that up, we're going to roll with some trigger point work. We're going to trigger point our glutes. Now, with any trigger point work, we do not want to put our entire weight on the ball right off the bat. And probably don't want to put the entire weight on the ball at any time, okay? So you can use a tennis ball or a lacrosse ball here. For the glutes, you're just literally working around each glute, trying to find a sore spot. So mine will be right there. So I'm going to hold on that spot until it releases. And if you don't have any super sore spots, just kind of scour around for about 45 seconds on each glute. Then we're going to work on our VMO. VMO is right above the kneecaps, basically where you would have a teardrop, in your quadricep right above the knee. So we're going to put that crossbow right in there. And then you're just going to kind of work it like you would a foam roller. Woo. Work it like you would a foam roller, about 45 seconds on each side. And then we're also going to trigger point TFL, so outside of the hip here. Now, drop down, again, slight pressure to start and then work into it. Do not put your entire body weight on here, okay? That's just probably going to bruise you and it's going to hurt and you're going to be mad. So, TFL, 45 seconds or so per side, all right? Once we finish up the trigger point work, we're going to move into some foam rolling. We're going to start with our glutes. Just going to work about 45 seconds on each side. Now, to get the gluteus maximus, which is the big piece of your butt, you want to be more squared up with whatever's in front of you. To get the gluteus medius, which is on the side, we're going to lean to the side just a little bit, all right? Then, we're going to move to foam rolling the hamstrings. You can go double leg with this. So just start at the back of the knee, roll it up to the top of the butt, or the bottom of the butt, sorry. 45 seconds or so, again with foam rolling, looking for those tender spots. If you find a spot, sit on it, flex, try to relax, and try to get that thing to release. Then, once we finish the hamstrings, we are going to go to the quads. So we're going to flip it over, single or double leg here. 45 seconds if you go double, and then 45 seconds a piece if you go single. Now, last two foam rolling things we're going to get. These can be pretty tender, so just kind of be careful with it and know that it sucks for everybody. So we're going to get our adductors, which is going to be on the inside of the thigh. So we're going to kind of flare out the right leg to start, and then you're going to roll all the way up into that inner thigh groin area and back down. Get about 45 seconds per side there. Then we're going to get our anterior tibialis, which is basically going to be your shins. So, have your arms out front, shins going to be on the forearm, or shins are going to be on the foam roller. Roll it forward towards the ankle, and then back. Now, if this is super tender for you, totally totally normal. Adjust how much pressure you put on there by how much weight you put on your hands up front. You get about 45 seconds there, and hopefully by the end of this session, should be about 30 minutes, maybe 35 minutes, you should have reduced some of the knee pain that you have going on. So, if you have any questions, leave a comment below, or just shoot me an email, and we'll get it hooked up. So, otherwise, have a good day, guys.